Welcome to Community Issues, a program designed to help you stay informed about matters affecting your community. This program is a production of this family radio station. Now here's your host for today's edition of Community Issues.
Animals play a variety of roles in people's lives, from work to companionship. Dogs in particular have helped humankind in various ways, from helping to herd sheep and cattle, to working alongside police officers and rescue workers, or even as guide dogs for the blind. But did you know that dogs also have a useful role to play in therapy? Join us today as Laura Hay, founder of Health Healers, tells us about her work with dogs in her animal-assisted therapy program. I'm your host, Dr. Susan Antlitz. Laura, welcome to the program.
Thank you very much, Susan. I'm happy to be with you.
As we begin looking into the issue of animal-assisted therapy, can you tell us about the background of Health Healers and its mission and how it all began?
Sure. Well, Health Healers is a company that I started that brings therapy dogs and therapy dog programming to a wide variety of organizations in southeast Wisconsin. We provide all the resources and expertise to set programs up for community organizations, healthcare facilities, schools, educational centers, shelters, places like that.
When did it begin?
Well, I started the company a couple of years ago. I have for a long time believed that some animals have the innate ability to aid in health and healing. And I have over 20 years experience as an occupational therapist helping people with a wide range of disabilities and conditions. I'm a lifelong dog lover, and I thought how perfect it would be to bring these two together so that the dogs could aid in the healing and recovery process in my patients. I earned a degree in animal-assisted therapy, and that provided me with the research base and knowledge that I needed to create my first program. And I created Health Healers.
I think I can see how animals can help people in therapy. The animals, if they're socialized, enjoy getting the attention as much as the people enjoy giving it. And animals are so non-judgmental when it comes to a person who has a health condition or a disability, emotional or behavioral challenges, or any other condition. I think perhaps the dogs can help people to be more open and have a better attitude. But I understand that Health Healers takes these benefits even further. Can you tell us more about your vision for what you wanted to accomplish with Health Healers?
The primary thing that Health Healers seeks to do is really provide exceptional programming to as many people as possible, both with and without disabilities, because the impact of what these dogs can do is so huge. And we really want to help places incorporate therapy dogs so that they can help people in their physical recovery. We can maximize learning in students, promote emotional wellness and personal growth, and just enhance the quality of life for many people.
How is the animal-assisted therapy done with Health Healers different than other programs that may be out there?
Well, there's a number of things. First of all, Health Healers is an active program. The therapy dogs are actively participating in innovative lessons, projects, events, and so on in order to assist professionals in implementing treatment plans, learning plans, or even in a counseling session. And most therapy dog programs are simply visiting programs. And Health Healers does provide these as well, and they do provide great comfort and motivation. But again, our focus is on the active role of the therapy dog in the process. It's also, Health Healers is operated by someone who's certified in the field and with specialty education in dog behavior and dog training. And we also provide service that helps organizations through the entire program setup and management, or through selected components of program development and implementation based on what they're interested in.
And how large is your program? Like what area does it cover in Wisconsin?
Primarily the greater Milwaukee area, including Milwaukee, metropolitan Milwaukee, and the suburbs.
Where are you located in Milwaukee?
We are located out of Menominee Falls, which is northwest of Milwaukee.
And if our listeners want to learn more, where can they find you on the web? I've seen your website, and so I know it's got lots of links on there and good information about your program.
Thank you. Yes, they can go to www.healthhealers.com. Now, that's healers with a double E, as in dogs healing at your side. And shall I give the phone number?
Yeah, that would be wonderful.
Okay, the phone number is area code 262-442-9633.
Can you tell our listeners more about some of the unique programs and types of therapy that Health Healers does? More specifically about the actual interactions that the dogs might have and the types of therapy that are done? Or also educational programs. You mentioned earlier that Health Healers works with learning programs in addition to therapy.
Sure. We do a great variety of programs. We have group programs designed for at-risk populations. These help clients work on social skill and character development, for example, learning anger management, coping skills, developing respect and compassion and empathy. And these all transfer over from their relationship with the therapy dog to their relationships with people. And we have therapy dog teams in classrooms using lesson plans that include the therapy dog and helping students, perhaps learn colors and numbers or science or math or reading. I've set up programs in healthcare settings where the dogs are active in therapy sessions with patients recovering from perhaps a stroke or a surgery, hospice programs where a dog can bring a special joy or peace to people in that situation. We have recreational programs and summer camp programs where the therapy dogs participate in games and arts and crafts, all geared to help the participants develop or improve personal or physical skills. So there's a wide range. That's just a portion of what Health Healers is able to do.
What's an example of a lesson that a class might do using the therapy dog?
For example, the students might create an obstacle course for the dog to go through, and in developing the course, younger children may be learning concepts of over, under, around, and through. So the dog may walk around a chair or go under a table and through a hoop, things like that. Older students can work on math skills and perhaps measuring the dog's performance and then graphing the results or the success. So it can appeal to all ages, and the students find it very motivating, and lessons are quite fun.
And then for some of the other types of therapy, I know some might just be the company of the dog as the person is recovering.
Right. Simply the presence of the dog really kind of creates an atmosphere where there's less stress and anxiety. Some of the situations where we're involved, people may be even fearful or apprehensive of procedures that they might be preparing to undergo and so on. And the dog can certainly add to their comfort and decrease the stress in situations like that.
And then I imagine for somebody who's recovering from a stroke and maybe doesn't quite have the same muscle control or coordination, even petting the dog might work some of those muscles and give them that opportunity to do that.
Absolutely, yes. And we see that when patients, as you said, are involved in the therapy sessions, their progress is typically much faster than what they have done prior to the dog being involved. So, the dog really brings a component to the sessions that didn't exist before and seems to really transcend the session to a new level.
Animals certainly can have a relaxing or calming effect on people. I have a little cat at home named Yoshi rather than a dog, and she's a wonderful companion. She acts a lot like a dog in some ways, though. She'll greet me at the door when I come home and curl up in the chair next to mine when I'm working on the computer. And if I move around the house, it's not too long before she'll follow me. And so she's there quietly present throughout the day. And it's very uplifting, especially for 2 years when I was living out of state in an apartment and was far away from my family and friends. I sure was glad to have another living creature at home to keep me company. That presence in itself is very therapeutic. I imagine that it would really make a difference when working with people with emotional problems too, since the dogs can have such a calming and relaxing effect and contribute to a positive interaction for people who may find other types of social interaction intimidating or frustrating. Can you tell us some about the work of therapy dogs with people with emotional or behavioral problems?
Working with people with emotional problems or at-risk behaviors, the dogs really create an environment where people are more comfortable sharing information that might typically be difficult for them to share with counselors or in a group discussion. And they also are freer to try new behaviors and to experience new behaviors in that kind of safe setting that the dog creates.
Do they ever take care of the dog as part of their therapy?
The dogs are there on a temporary basis. They are brought in by specially trained volunteers who are certified as a team with their therapy dogs. So the dogs come in temporarily for the purpose of the intervention. But within that intervention or session, we do include opportunities for people to tend to the dog or to train the dog and things like that.
So it's not like it's their dog to take care of, but the dog will come and visit them, and then they might be able to brush the dog or train the dog or whatever they may need. And then I think that would give the patients a sense of responsibility, being able to take care of another creature.
Exactly.
I know I've heard that for the elderly, that's something that's very beneficial to them as well, just having something to take care of and tend to.
And it gives people a sense of purpose and helps them to define their role as a nurturer or a caregiver, which can help empower them as well.
Are there other examples of some of the specific therapies that might be used?
Well, some of the things I've done with the at-risk groups are we do a simulated bowling activity with the dog where the clients have to work together using cooperation and good teamworking skills to figure out how to get the dog to knock over the pins. There are some restrictions, so they're not able to touch the dog or to use a leash to guide the dog, so they've got to do a lot of problem solving together. Sometimes they get an opportunity to work on frustration tolerance so that they're building patience and learning how to communicate effectively and clearly and appropriately with one another as they develop their strategies and then take the dog through the process. So that's always a fun and very motivating and meaningful activity.
And so it helps them to build the teamwork, and they're actually learning to deal with each other as they're trying to learn how to work with the dog to get the dog to knock over those pins.
Very much, yes, very much so, yeah.
We've been talking with Laura Hay, the founder of Health Healers. And Laura, could you give your contact information, your phone and website again?
We're at www.healthhealers.com, and that's healers with a double E, as in dogs healing at your side. So it's www.healthhealers.com, and the phone number is 262-442-9633. It's area code 262-442-9633.
Laura, we're coming to the end of our time today. Would you be willing to come back next week and talk to us some more about your wonderful program?
Thank you very much. Yes, I would be happy to do that. Thank you.
I'm Dr. Susan Antlitz, your host for Community Issues, and our guest today has been Laura Hay, the founder of Health Healers. Please join us again next week for another edition of Community Issues.
This has been Community Issues, a program designed to help you stay informed about matters affecting your community. The views expressed on this program are those of the participants and not necessarily those of Family Stations Incorporated. Thanks for listening today, and join us again next week at this same time for another edition of Community Issues.